I love success stories, but most of the time when patients come in, they are not in a place of thinking success. In fact, they're probably at the lowest level thinking that this is the end of the road. And I have one of those patients I'd like to share her story with you. She had seen her eye doctor for the past 2 years trying to help her with her dry eye symptoms. And they tried everything, pharmaceutical options, all the things you read about in the books. And they did their best, but it wasn't giving her relief. So when she came to my office, she thought this was the end of the road. And she thought she was going to have to deal with this chronic discomfort, poor vision, and pain for the rest of her life. If the first treatment that we didn't work, she wouldn't have any other options. The crazy thing is, it's not necessarily the treatments that you're doing, it's the order that you're doing them and how they're being applied at home. So we came up with a specialized treatment plan for her. We started doing autologous serum. So that's actually where you take your own blood, get rid of the solid particles, and use the serum as eye drops. And it heals your eyes. We also stopped her doing all pharmaceutical options at home, and we prescribed IPL, intense pulse light therapy. In addition to doing the serum, the IPL therapies, we had her start doing omega-3 supplement, and then we saw her every 3 weeks for treatments. We did 4 of these treatments, and the results were amazing. When she had came in, her eyes were red, irritated, and angry. Well, the serum helped reduce any of the damage and inflammation on her eyes. They're still getting better, but the improvement was pronounced. Her lids, because of the IPL therapies, were less inflamed and the glands were expressing oil. When oil is coming out of those glands, it's helping make that tear film more stable. So not doing a warm compress, just doing IPL and the serum, we got her a more stable tear film. And the omega-3s were giving her healthier oils. So those 3 things sound simple, but the order in which we did it, the frequency at which they were being done, and her diligence to the therapy that we had prescribed gave her an amazing result. She came in with her mother-in-law, and her mother-in-law said she could not believe how different her demeanor was. She was almost in a state of depression before she saw us, and she was smiling, bubbly, and very excited for what was to come. And the crazy thing is, we just scratched the surface of the options we have to get her eyes feeling better. We didn't want to overwhelm her with all the technology, all the options we have available at our office, but we started slow. We did the things that would give her the most benefit the quickest, and she's already seeing results. So the reason I have this conversation with you is if you are feeling this way, or you know someone that says they've tried everything, make sure they give us a call, because we specialize in dry eye and ocular surface disease. And it's patients like these that make our day, where we can give them their vision, their eye care back. We always say we like to restore hope and give rejuvenating eye care. It's not just something we say, it's something that we do, and this patient was a perfect example. Like and subscribe for more tips.